just to kind of keep things running smoothly. So the chat will be for CARB to provide links and other information. If you would like to submit a written question, please do so by clicking the Q&A icon at the bottom of your screen. You can type your question in the panel on the right-hand side of the presentation window. If you want to ask a question live, you can use the raise hand feature by clicking on the reactions icon at the bottom of the screen. We'll have time for questions and comments at the end of the presentation. We'll call on you to ask your questions and unmute when it's your turn. When called on, please identify yourself and your affiliation. And we do ask that you let us know if you have a question or a comment. And if you have a comment, again, we're going to limit comments to just 2 minutes. Now, I'd like to take just a minute to introduce the CARB staff who are part of today's workshop and who are helping with the guidelines update. So we have Elizabeth Shealy, who you just heard from. She's the chief of our research division. Also with us today is Bonnie Holmes-Jen. She's the branch chief and health and exposure in our health and exposure assessment branch. And we have Pat Wong. He's the manager of our building and indoor environment section. I'm Jeff Williams. I'm the lead for the IAQ guidelines. And then we also have Zoe Zhang, who's our technical lead. For today on our agenda, we've just done the welcome and the housekeeping. We'll go ahead and move into the presentation in just a moment here. And that's going to cover the background and health effects. And then we'll discuss the approaches that we're considering for updating the guideline. After our presentation, we're going to move into the question and discussion portion of the workshop. We're going to open the Q&A with an initial set of questions from CARB to get your thoughts about approaches that we're considering for the updating the guidelines. Also, technical advice about any potential benefits or drawbacks to the respective approaches and other topics. Then after that, we'll open the Q&A for general questions and discussions. And I will say we'll have a few minutes before we go into the sort of predefined questions to also just ask for any clarifications and things like that. Then at the end of our Q&A, we'll have some brief closing remarks about the next steps before we adjourn. Okay, so we'll go ahead and start with the presentation then. And this is about the need to update CARB's guidelines. And we last published our indoor air quality guidelines in 2005 in a report to the legislature titled Indoor Air Pollution in California. CARB's indoor air quality guidelines are for selected pollutants, including formaldehyde, carbon monoxide, and particulate matter. This first update to the indoor guidelines is starting with NO2. Since the 2005 CARB report, agencies such as Health Canada and the World Health Organization have adopted more health protective indoor guidelines for NO2 and other pollutants based on more recent studies. We've seen an increasing call for action from community-based organizations for updated guidelines. Vulnerable communities are at greater risk of exposure to high levels of indoor NO2. And these guidelines will help them to understand what indoor levels are protective of health. Updated guidelines will provide an evidence-informed tool to provide guidance for indoor air quality policies, the development of less polluting appliances, updating building codes, and other mechanisms to achieve greater reductions in indoor pollutants. New guidelines also have the potential to motivate research and will provide input for the updated indoor air quality report, which is being completed under a contract with Dr. Yifan Zhu. Now, just to kind of set the context for this talk, I think it's helpful to just clarify the difference between a guideline and a standard. These terms kind of often get used interchangeably. Basically, an indoor air quality guideline is voluntary. It's a health or risk-based benchmark for safe concentration thresholds for indoor air pollutants. In contrast, an air quality standard is enforceable. It's a maximum concentration level in outdoor air that's set by CARB or the US EPA. These mandatory standards are based on agency assessment of the maximum amount of a pollutant, and that's averaged over a specific period, that can be present in outdoor air without any harmful effects on people or the environment. We know from multiple time activity studies, excuse me, that people spend about 90% of their time indoors. There's also a significant body of research showing that indoor NO2 can commonly exceed levels that would be considered unhealthy outdoors. Professor and Nobel Peace Prize recipient Kirk Smith highlighted the exposure implications of these two facts when he stated that an amount of pollution released indoors produces about 1,000 times more exposure than the same one released outdoors. Of course, this can vary by situation, but it's generally applicable. The primary indoor sources of NO2 are appliances, such as stoves and space heaters. And the most effective approach to improve indoor air quality is usually to remove or reduce the sources of indoor pollution. Ventilation helps to remove indoor air pollutants, but it's not as effective as source reduction. Although we tend to not think of our homes as sources of outdoor pollution, the reality is that NO2 and other pollutants that are generated indoors from vented and unvented appliances impact both our indoor and outdoor air quality. Now, there's an extensive body of research demonstrating the health effects of exposure to NO2 through multiple lines of evidence, such as controlled exposure studies and epidemiological studies. Also, short-term effects of nitrogen dioxide exposure have been demonstrated in controlled exposure studies. These studies have shown that nitrogen dioxide can aggravate respiratory disease, particularly asthma, leading to respiratory symptoms such as coughing, wheezing, or difficulty breathing, and hospital admissions and visits to emergency rooms. Epidemiological studies that have followed long-term exposures to elevated concentrations of NO2 have found that it is associated with the development of asthma and may increase susceptibility to respiratory infections and increase mortality, particularly in children and the elderly. A recent study by Cashton estimated that gas and propane stoves increase long-term NO2 exposure, and that the increased exposure likely causes approximately 50,000 cases of current pediatric asthma in the US from long-term NO2 exposure alone. As mentioned previously, indoor levels of NO2 can often reach much higher levels than outdoor levels, and the association between exposure to indoor NO2 sources and health effects has been studied for decades. The 6 Cities study was a longitudinal study in the mid-80s that examined the respiratory health effects of air pollutants on over 6,000 children. And the effects of exposure to NO2 sources was further investigated by examining a cohort of over 1,100 children and their respiratory health. The assessment found that a 15 ppb mean elevation of NO2 in homes was associated with an increased cumulative incidence of lower respiratory symptoms. A 2013 study found that asthmatic children exposed to indoor NO2 levels well below the US EPA annual ambient standard of 53 ppb were at increased risk for asthma morbidity. More recently, a 2022 study found that nearly 13% of asthma cases in the US could be attributed to gas stove use. Furthermore, the authors of the study estimated that the proportion of asthma that could be prevented if gas stoves were replaced with zero-emission alternatives would be about 20% in California. Finally, a newly published study out of Stanford found that NO2 exposure from typical gas stove use frequently exceeds both World Health Organization and US Environmental Protection Agency benchmarks. People living in residences less than 800 square feet in size incurred 4 times more long-term NO2 exposure than people in residences greater than 3,000 square feet. Also, American Indian and Alaska Native and Black populations saw 60% more NO2 exposure than the national average, and Hispanics and Latinos were 20% higher. Now, in the US, there's a paucity of guidelines for indoor air quality, and we're seeing federal and state agencies around the country also pursuing the development of new guidelines or updating existing guidelines. Here are some of the efforts being made by other agencies related to indoor guidelines. Although the CEC is not developing guidelines directly, they are actively funding a significant amount of research to investigate the impacts of combustion appliances and ventilation on indoor air quality. And I'll discuss some of their relevant current and past research in the next slide. The EPA is also in the process of developing indoor guidelines, and they're focusing their initial efforts on guideline values for PM 2.5. The California Department of Public Health is also exploring the development of indoor guidelines for PM 2.5. And actually, I'm part of the CDPH task force that is working on the PM 2.5 guidelines. And that work is complementary to our efforts here at CARB. Finally, the Consumer Product Safety Commission convened a task force of industry and consumer interest groups to make recommendations for voluntary standards and for, or I should say guidelines, and for code bodies to improve IAQ in homes from pollutants emitted by gas ranges. A working group within the task force has recommended adopting the Health Canada residential indoor air quality guidelines. Now, as I mentioned in the previous slide, the CEC has been very involved in research related to the impacts of gas stove use and ventilation on indoor air quality. And this is just a brief summary of some of the important research that the CEC has funded. A study that is currently underway is the Seneca study. And the goal of that study is to measure indoor air quality and potential health benefits of switching to electric cooking appliances, as well as interventions to reduce cooking-related exposures to pollutants in homes. The study is replacing gas stoves with electric induction stoves in homes in Fresno, Bakersfield, and Stockton, and will monitor changes in indoor air quality, as well as symptoms of asthmatic children who are in the study homes. A new study that is expected to start quite soon will quantify indoor pollutant exposures to residents of multifamily homes. The purpose of this project is to quantify and characterize residents' exposure to indoor air pollutants generated from kitchen stoves, such as gas, electric, and induction in multifamily homes. Past research projects have included a comprehensive study of the effects that Title 24 ventilation standards have had on air quality in homes, gas appliances, built between 2011 and 2017. The study found that measured concentrations for most pollutants were below health guidelines, indicating that IAQ is acceptable in new California homes when ventilation is used. Another study investigated ventilation performance and range hood use in homes and low-income apartments. The study determined that there were operational deficiencies with mechanical ventilation systems in a significant number of the apartments. And the study also found that hood use is sporadic, just over about a quarter of the people in apartments using the range hood during cooking, and only about a third of them using it in homes. All right, so just going to give you a little bit of history of the process or indoor air guidelines. And CARB's most recent published indoor air quality guidelines were part of its 2005 legislative report on indoor air quality, and the 1 hour NO2 guideline was set at 250 ppb. Since then, CARB and USEP lowered their ambient air quality standards in 2007 and 2010, respectively. Afterwards, WHO and Health Canada updated their IAQ guidelines, with the major updates in 2015 for Health Canada and WHO just a couple of years ago. This is a snapshot of the current guidelines from CARB, along with those from Health Canada and WHO. And I think what stands out here is you can see that CARB's 1 hour and 24-hour guideline values at 250 and 80 ppb respectively are significantly higher than the current Health Canada and WHO indoor guideline levels. Now, this figure provides just a broader look at the different guidelines from around the world using a database that was recently compiled by the International Society for Indoor Air Quality and Climate. The figure provides a better context about where the existing CARB guidelines fall in comparison to guidelines from other countries. You can see that for both the 1 hour and 24-hour guidelines, the CARB's values are significantly higher than the others. And I apologize for my rough voice. I'm struggling with a little bit of allergies today after all that wind. So, all right, let's. Oh, my slides are not big. Let's see. Am I still? Am I still live on there, guys? Can you hear me?
Yes.
So we're
Okay.
seeing you in presentation, full mode.
Yeah, I should be in presentation then.
Yeah, so we're seeing that now.
I can see that
Okay.
with the notes.
Mm.
Okay, so something has happened with my presentation. I'm going to stop sharing for just a second. I'm going to go ahead and reshare. I'm not sure why I did that, but hold on just a second. We'll get back. I might have to have you share the slide. I'm not sure what's going on. Just give me one more second here, Pat. I'm
Okay.
gonna relaunch PowerPoint. PowerPoint might have just crashed or something. Sure.
This is mine, so if needed, let me know.
I will. Give me 1 second here. I'm gonna try sharing. Okay, this looks better. Yeah, there we go. I think we're there. Okay, are you guys seeing the presentation now? Great. Okay, sorry about that. Something happened, it froze up. I believe this was the last figure I was on, so we'll go ahead and go on to milestones. So this is a timeline of our guideline development process so far. We started the process late in 2022, early 2023. And we had our first workshop in the spring of 2023, and then used the information from that workshop to determine the approaches that we're going to discuss today. After the workshop today, we'll take the information that we've gathered and develop a draft IAQ guidelines document, which will then be presented in a public workshop later this year. We hope to have the guidelines finalized in the document released to the public in early 2025. Our first workshop was in the spring of last year, and we invited representatives from WHO and Health Canada to present on their experiences and processes for development of indoor guidelines. In addition, we heard perspectives from the Department of Public Health, OEHA, and the Energy Commission. We also invited participants from community organizations such as WEAC, Physicians for Social Responsibility, and the Central California Asthma Lab. We rounded out the workshop with technical experts from academia and the health sciences. During the workshop, we heard presentations on a wide range of topics, such as the health impacts of indoor air quality, current research on indoor air and exposures, and the scientific basis for setting guidelines, and how the guidelines might be used. Also about the indoor air quality impacts of NO2 and EJ. In the first half of the workshop, we heard very informative presentations from our health scientists from the Health Organization, Health Canada, and our invited state agencies. The common theme was that now is an excellent time to update the CARB indoor guidelines. There are many new studies about the health effects of NO2. We also have a better understanding of indoor sources and ways to control indoor pollutants. We also heard again about the challenges of dealing with air pollutants in the indoor environment and the commonplace exceedance of health-based standards. Both WHO and Health Canada developed their guidelines based on what they determined would provide an adequate level of health protection for the health of sensitive groups. We also heard about reducing exposure to NO2 in the indoor environment. And it was clear that meeting lower levels of NO2 in any new guideline would best be achieved by a combination of source reduction and improved ventilation. In addition to learning about the need for updated guidelines, another objective of the workshop was to learn about the process and perspectives of guideline development from other organizations. Both WHO and Health Canada engaged in a process of extensive literature and scientific review. It took years to complete. And of note, the WHO did not include studies in the health effects of indoor NO2 in their development for their guideline, whereas Health Canada adjusted their residential indoor air quality guidelines so that a higher percentage of homes would be able to achieve the indoor guideline levels. In the second half of our workshop, we heard from our invited community organizations and experts from the health field and academia about the impacts of indoor quality in environmental justice communities. Our first speaker from the community group discussed their first of a kind pilot study of indoor air quality in New York City. Indoor air was monitored in 20 apartments where half used gas stoves and the other half were switched to induction cooking. The study found that the households that switched to induction saw a 35% daily reduction in NO2 levels. Although there was a clear IAQ benefit to using induction stoves in homes, it was also emphasized that low-income communities face significant IAQ challenges to reach the electrification starting point. In another presentation, we we heard about the broad inequality of pollutant exposures faced by the environmental justice communities. We also heard about the systemic issues that impacted those communities, such as redlining and the Federal Highway Act, and how these have been a barrier to achieving health equity. The need for better tenant protections, building codes, and health guidelines will all be important tools for addressing the long-standing inequalities in these communities. Finally, we heard from our experts in academia and medicine. We learned about the past and current research that has informed our understanding of today's challenges for improving indoor air quality. And we heard about the broader health impacts of chronic exposure to NO2, such as non-respiratory effects like neuropsychiatric outcomes and metabolic effects. Okay, so with that, I'm going to hand the presentation over to Pat Wong, and he's going to discuss the approaches that we are considering for updating our guidelines. So Pat, over to you.
Okay, thanks, Jeff. So information from the first workshop, along with discussions with our sister agencies, have given our team a lot to think about for this guidelines update. We will now present some approaches that we've been considering between the first workshop and now. A final determination has not been made on the direction that this assessment will take us. There are a few guiding considerations that will help with which approach will be selected to go forward. This includes approaches to provide a high level of health protection based upon peer review studies. In particular, this includes studies that were used for the Health Canada IAQ guidelines. Other considerations would be streamlining development timelines, feasibility of new guidelines, and ensuring that possible benefits would include impacted communities. In 2015, Health Canada developed 1 hour and 24-hour health values for indoor exposures to NO2. The first determination that was made in their science assessment document was a determination of the reference concentration, also known as RFC, for NO2, which was defined as the level below which health effects are not expected to occur in the general population, including sensitive subgroups. This was determined by looking at scientific literature values to see what levels of NO2 provide the lowest observed adverse effects and implementing uncertainty factors to account for individual variations. The advantage of this approach is the most health protective, but the main challenge is that much more work is needed to achieve these levels, especially in areas of high outdoor NO2 values. Approach number 2 is also based upon Health Canada indoor air quality guidelines, which use their health values and which at the time were determined based on what was considered achievable, but yet provided benefits for health, essentially a risk reduction approach. Achievability was based upon what was attainable with stovetop ventilation for the 1 hour health value and what was attainable in most Canadian homes for the 24-hour value of source reduction and ventilation. This approach, while not as health protective as approach number 1, would still provide health benefits, but would not be as supportive of CARB's electrification and exposure reduction goals. Approach number 3 would be to not adopt existing health value numbers, but instead have CARB and OEA develop possible values using similar methodology, but would focus on more recent scientific literature values. The benefit of this approach would be that more recent studies can be included and possibly studies can be tailored for the California population. However, this process may take years to complete. So this slide shows the implications of either of the first 2 approaches are selected. For approach number 1, the one that provides the maximum health benefit, it can support future source reduction policies as well as improve home and range ventilation measures. For approach number 2, it still provides some health benefits and can be mostly achieved through ventilation measures. The following 2 slides has the references mentioned in the previous slide, and this concludes the presentation part of our workshop today. We're now going to open the workshop to questions and comments. Bonnie Holmes-Jen, our branch chief in the Health and Exposure Assessment Branch, will be the moderator for this part of the workshop.
Okay, thank you. Thank you, Jeff and Pat, for the excellent presentation. I think what we would like to do, we'd like to focus on gathering information on these proposed approaches. But before we go into the questions that we have prepared for everybody, we wanted to ask if there are any questions of clarification. Are there any folks want to ask any questions about the content, for clarification of the content that was presented, or clarification of the three approaches. And we'll just do a check and see if there are any of those types of questions. And then we'll share the questions that we were wanting to focus everybody on. Are we seeing any?
And so again, if you have a question, just raise your hand and we will ask you to unmute and you can ask your question online. Or again, you can put a question in the Q&A if you have a question.
So why don't we go ahead and show our discussion questions. And if we see any questions of clarification, obviously we'll jump to those.
There are some,
There are some questions in the
Okay.
Q&A.
Okay.
yeah, if you look on the right there.
Yeah.
Okay.
And do we want to have Kai read those out?
Yeah, that'd be great.
Hi, everybody. We do have a question here, anonymous. Do you have an idea on the effect of operation of range hoods, mechanical ventilation, on the concentration and exposures of NO2 in homes if used properly?
Yeah, I can take that, or Zoe can take that, but I'll just say that as we said earlier, in newer homes, you would expect to see that if the ventilation is used properly, you can see a significant reduction would be below the exposure levels that are considered unhealthy. The problem with mechanical ventilation is that it's either rarely used or oftentimes also the capture efficiencies are quite low, typically below 70%. So you do kind of have to go through some like proper use of using the back burners or sometimes shrouding the hoods to get more of the to improve the capture efficiency. And then also some range hoods don't actually ventilate to the outside, they just recirculate the air, they filter out the particles, but they don't necessarily take care of gases. I don't know, is there anything you want to add? Is that's it?
Yes, so Jeff is right. The efficiency of range hood is really depends on many factors like the airflows and the configuration of the hoods, and also depends on which burners you're using. So I will refer you to LBL study. They conducted a very comprehensive study checking range hoods efficiencies, and I can share that with you after this meeting.
Yeah, we have our list of references, and those will be available with the slides that provide information on all the studies that we cited in the presentation. And we're also very open to getting submissions of additional studies that any participants would like us to look at on any of these topics. We hadn't planned an in-depth discussion of individual studies, but we are very happy today, but we're very happy to take a look at any studies you want to submit.
Yeah, and so I saw Frank Johnson, you'd asked about the references slide, so I have the first one up. I'll go ahead and advance. There's the second references slide, and if you need any of those, certainly reach out to me. I'm happy to send you this, or you can just see them on the slides when we post them.
One of our participants, Brett Singer, has his hand raised.
Thank you. And great presentation, Jeff, and really glad to see this work. Just wanted to add to what Jeff said about the newer homes. So in California, both general ventilation, like for the whole dwelling unit, and also for the kitchen ventilation is required. And based on some work, and I think it's not in this reference list yet, but we can provide it. We did a modeling study basically to help the Energy Commission with their multifamily housing standards to basically increase the requirements for kitchen ventilation, so that in smaller homes they had basically with gas higher ventilation rates for the kitchen, so that you still of course need to use it, right? But just in newer, at least in newer homes in California, there's some accounting for the need for better equipment, either with the capture efficiency or higher airflow. It doesn't solve the problem, obviously, for everybody. And I think your guideline would, go a long way toward raising awareness, and hopefully, having people use the equipment they have. I guess it's mainly just a credit to the Energy Commission for thinking of this issue and updating their standards to make sure that at least new homes are getting better equipment.
Great, thanks. I really appreciate that, Brett, especially since you've done so much work in this area. Okay, any other questions online, Kai?
Yes, Tom Phillips posed a question. Will a cost-benefit analysis include health benefits from reduction in space heating with gas stoves, burn and fire hazards, and GHG emissions? Will both portable induction stoves and ranges be considered in that analysis?
You want to answer that? Or you want? Yeah, hi, hey, Tom, thanks for the question. And yeah, we're not doing health benefits in this per se. That's something, I think that kind of information will come out of the CEC studies.
This is not a regulation.
Right.
I mean, we will look at all aspects of maybe how this can impact, but it's not probably going to have the normal regulatory health benefit analysis that is normally done.
Now, I would note also that we're at an early stage still, as
Right.
as Jeff mentioned,
Right.
Jeff Williams mentioned earlier. And so we'll certainly, take all those comments about what might be included and get it at another point in time. But at this point, we're really trying to focus on what comments do you have on the suggested approaches, and what are some of the benefits and challenges of the approaches that we're considering. And it might be helpful if we just go ahead and go to our questions. We're not going to cut off.
It looks like there's another question. Or
Yeah, that's
raised
right.
hand.
And we'll get back to it.
Oh, okay.
We'll get back to it. Why don't we
Okay,
just
yeah,
go-
and we have Kai moderating our questions. Brett, I see your hand is still up just before we move on. Did you still have a comment?
It was a separate comment, just to Tom's comment, that Civica study that you mentioned. It's
Yeah.
primarily looking at replacing gas stoves with electric induction ranges, but we have a sub-study in there where there's some fraction of homes which can't get the electric ranges, where they're going to provide them with 2-burner portable induction cooktops and other electric things. So that we will be able to at least have some idea of how much exposure reduction can be accomplished with that kind of portable equipment. So.
Okay, great, thank
Thanks.
you. Okay, so we still have some questions in the Q&A. We will get to those. We should be able to get to those in time. But we do have some questions that we're actually interested in. I'm gonna let Bonnie talk about that.
Yeah, just again, we'll get back to the questions. We have lots of time. But just wanted to show those questions that we are hoping that people will think about and provide some responses to during this workshop time. And as we said, the main objective of this workshop is, of course, to share all the information that we have been evaluating, but to look specifically at the approaches that we might pursue in adopting indoor guidelines, updated indoor guidelines for California. So we have prepared some questions that would help us to get your feedback on the approaches, on the technical challenges that we might face, and the mix of technologies that are available to achieve the guidelines. As you can see, we have questions. What do you view as the greatest health benefits or benefits generally for these respective approaches? What are the biggest challenges to achieving the guideline levels that we've included in these approaches? What technologies and practices will help best achieve reductions of NO2? What are the equity implications and barriers for low income and middle income communities? What are the potential costs to communities? And how can we improve our outreach efforts to maximize the benefits of new guidelines? So we will get back to the questions, but we would appreciate if you would think about some of these questions that we're posing, and if you can share some comments, responses that you have to these questions, that will greatly help us in moving forward. We're also interested in how we can best message our guidelines when we get to adopting them and messaging them and promoting use of our indoor air quality guidelines. Okay, so why don't we just go back? Is there a hand raised or should we go to the Q&A?
I don't see any hands raised.
Okay, we do have a question. Since cooking in general, regardless of fuel, generates PM 2.5, which requires ventilation, does CARB plan to address that?
Where this isn't a PM 2.5 regulation, guideline. As I had mentioned earlier, the California Department of Public Health is actually looking at updating PM 2.5 guidelines for the indoor environment. And that's sort of a parallel effort to what we're doing here with NO2. So I envision that is probably where that would first come.
Okay, we do have one more question. Could you please
Hey, hold on just a second.
Sorry, no, I just say, as Jeff mentioned, NO2 is the first indoor air quality guideline we're looking at updating. And after we get through this process, depending on what other agencies have done, we'll be looking at other pollutants and the need and the priority for adopting indoor guidelines.
Right, exactly. Yeah.
Also.
This is the first step. Correct.
Thank you. Go ahead, Kai.
Okay, last question that's currently in the Q&A. Could you please repeat the reasoning behind showing alternative approaches to guideline development? Which approach is CARB anticipating to take?
Yeah, I could take that. Well, the reasoning behind showing the alternative approaches is that we don't want to reinvent the wheel. We do realize that Health Canada, we talked to them, spent a number of years going over the literature and for putting in their indoor air guidelines. So that's why we're basing the first two alternatives on that. Part of which one we're anticipating to take, that's part of this is the reason we're having this workshop. We kind of want to see if anyone had an opinion, had some ideas or comments on either one of those two approaches, or approach number 3, where we would look at, along with OEA, newer literature, but probably have a similar mathematical approach that Health Canada did.
And I would, generally add that based on the discussions that we've had so far and a review of the information behind the Health Canada a guideline, that we're interested, as Pat said, in building on the work that was done, the extensive scientific review, the extensive literature review that was done. So I think we could generally say that we're tending toward trying to build on and use that the Health Canada guideline development, whether we would move toward the maximum health protection or the risk reduction approach. That's one thing we're asking for comment on. But we would, given the time and resources and the need for an updated guideline, we would tend to move toward taking advantage of all that existing work. I don't know if Jeff would to that.
Yeah, no, I think that. And I would just say, we have a lot of interested stakeholders and experts online, and if any of you do have any thoughts about these questions about if you favor a particular approach or what you view to be the biggest challenges, I'd be curious to hear about. What are your thoughts? What are typical concentrations indoors, and what would be the best way to achieve these levels, and what mix of technologies might be? I'd be interested to hear if anyone has anything to offer in that regard.
Yeah, and I would also note that we do have the ability for participants to submit information to our staff, and we have the email addresses we've included in our slides, and I believe also in the chat, and we also have online submission through our website information.
So I did see that there was a question in the chat, actually. It helps to put it in the Q&A, but it's fine. This is from Steve Kemps to everyone. What does sensitive individuals mean? That wouldn't include NO2 as an asthma trigger. I'm not exactly sure I can maybe just speak a little bit about the Health Canada approach, and they looked at both healthy individuals and they looked at sensitive groups. And when they looked at NO2, they saw that the healthy individuals, their lowest observed adverse effects level was about, I think, 1,880 micrograms per cubic meter. When they looked at asthmatics, children, those sensitive groups, that reduced down to about 500 micrograms per cubic meter, which is approximately 250 ppb. So that maybe provides some context about the difference. And then I don't know, does anyone, Barbara, anyone have anything to say in addition to sensitive groups?
Yes, this is Barbara Weller, and I work in the health branch as one of the managers. And generally speaking, sensitive groups for NO2 are definitely considered to be asthmatics, children, the elderly, and anyone who is under-resourced. So people who experience less resources for healthcare, and additional stresses would also be considered sensitive groups. So it doesn't just include the asthmatic population, but includes people with other pre-existing conditions, as well as thinking about people whose general health can be compromised because of lack of resources or additional stressors that they.
Thank you.
Common asthmatics are individuals, not.
Yes. Very much so.
Well, we have a fairly quiet group online, a group of individuals.
Maybe it might be helpful just to recap a little bit for the group as to, as a reminder, why we are proposing to update our indoor guidelines for NO2 now. Maybe just kind of a quick recap.
Yeah. And there are several reasons, but I think I pointed out in the slide that now seems to be a very good time to do this. Part of it is there have been calls by several community groups and an increased interest in improving indoor air quality and realizing that there are big disparities in environmental justice communities with indoor air quality and exposure to nitrogen dioxide. And so that's part of it. Also, there's a lot of new information out there. We've got, again, WHO and Health Canada, who have recently or more recently updated their guideline values. And honestly, CARB is just somewhat behind on getting those, I shouldn't say behind, but it's a good time for us to update our guidelines as well. And so there's a lot of new information available that we need to be considering and that we can take into account with moving forward and updating guidelines. And I noticed, let's see, Brett, I think, has a raised hand.
Yeah, I do, and I'm gonna I'll make a couple of comments, but I think actually it might be helpful to go back over the strategies, because you put those up and you spoke about them well, but like I don't know if you have like one slide that sort of like notes, like has the highlights of each of the strategies, because it's helpful to like see those again, right? Like I think I absorbed them, but that because they are very different with regard to these questions, right? And I'm gonna maybe just make a couple comments, and then if you can maybe put those up again, I may have some more, maybe others would have more with seeing them again. But just to spur the like discussion, and I think you mentioned this, but if not, then I'll mention it here, which is that like there's always the balance between the first time you create something, trying to like introduce it in a way that's like sort of more palatable and acceptable, and you did actually, I remember talking about this, like there's a balance between like you can do that if you go on the more conservative side, then you don't maybe get as many benefits, but if you go too stringent, then you risk people like writing them off and not paying attention to them. So right, so the approach number one, right? I was glad to see you look at Health Canada rather than World Health. Just I'll note that that's a separate thing that we could get into if somebody wants to, but
Okay.
getting back to your questions, right? I think that like, because one of the questions like, what's the what first of all, what are we going to get from this, right? And secondly, like, how can we maximize what we're going to get for it? I think that like, putting targets, these are guidelines, right? These aren't like requirements, right? So putting down and say, here's what everybody should be aiming for. And maybe the way to like thread that needle from the like more stringent versus, something that's quote unquote more achievable is to say like, maybe go with the more stringent, say here's really the targets, right? This is like the targets, these are guidelines, this is for maximum health protection. But like, we recognize that not everybody in every situation can get here, right? And the messaging is like, it's not like all or nothing. It's not like if you don't get to this level, then you're killing people, right? Like that's the thing I most struggle with, where the public sees these things and they're like, well, they're not meeting, my landlord is not meeting these guidelines, right? And that creates a lot of tension and a lot of animosity, right? Where really what we want to say is like, okay, like, let's get as far as we can get with the available resources, right? And so maybe it's like, here's the targets, but like, the one thing the World Health Organization did pretty well, which is sort of say like there's different gradations, or right, like it's like, here's the best case, but maybe this is still good, something like that. Communicate that like, okay, like these are the very protective levels, but like for most people you don't need to reach these levels, right? This is like for the most sensitive people. So if you're like not in the camp of the most sensitive people, right, you can still reduce your exposure and health risk by just reducing your emissions using these strategies, all the strategies that you guys have talked about. Anyway, I'll shut up now. I just wanted to like, I think the communications, the point being, I think the communications, how it's framed is as important as the actual standards or the guidelines, not the standards, right? Like what you communicate about them is as important. I'll shut up now. Thanks.
I just wanted to say, I think that's an excellent comment on the communication. I really appreciate that. Before Pat, I mean, I think it'd be great if Pat goes through the three options again. And when you go through them, Pat, maybe you could talk more also about the benefits and the challenges that we have on the slides also. Or give a little broader discussion about each one.
Okay, yeah, I can do that. For approach number one, the benefit is this is very health protective. When Health Canada did their scientific assessment, they essentially looked at all the studies, and this is the level which below which you would not expect health effects, and then they added uncertainty factors to make it account for variability, individual variability. So that's definitely the most, I guess, the biggest benefit. Challenges, since it is the most hardest to achieve, is that you would need a lot of different strategies, possible electrification, and then getting it into existing homes and businesses is a lot difficult. I know in California we do have a building standards codes that only applies mainly to new buildings and not going back to older buildings. So getting that change out will require other type of programs. And secondly, a lot of the NO2 indoors does infiltrate from the outdoors, and there's no way to really control for that with indoor sources. So that's the second part. I mean, if you're in an area with really high NO2, you could have less sources in the home, but still have a high amount in there. So that's
Right.
the issue with approach number one. Number two, yeah, that one sort of based on Health Canada. How they set that up is they looked at what was attainable in most homes, and that was in 2015. It's probably even more attainable now with all the increased ventilations, better home builds, and also the efforts now to replace gas stoves with electric stoves. So it's, it's probably a lot more easily achievable. And the benefits, of course, is no matter what level you're looking at, lowering or having a guideline would be healthy, even probably for sensitive groups. And most California homes should be able to do that. The challenges is that it probably doesn't help support as much of the electrification exposure reduction goals. And it is slightly higher than approach number 1. And should we go with the third?
Yeah.
Okay, yeah, the third approach is, if we use a methodology similar to what Health Canada did, looking at all the literature, finding what's a lower level and putting uncertainty factors, it's very similar to what OEA does right now for air toxics. The one advantage here is that for the, Health Canada was 2015, and most of their studies were probably 2012, 2013. There may have been studies in the last 10 years which show that NO2, may need even a lower level of NO2 production. We have not, and OEA has not looked at that literature yet. And also, it will take a while to do that.
Right.
And that would take well, that would add more time
Yes.
to the process.
Several years.
Yeah.
Right.
And I know, Jeff, you had, you have a list of those 3 approaches. I think it was in the chat, but people
Yeah.
that joined since then, it doesn't show up on mine. So maybe you could read.
So yeah, if you scroll to the top of the chat, it will show up, and I will go ahead and repaste those in. But yeah, I went ahead and just, as Brett had pointed out, it might be nice to see them in one place. And so here they are again in the chat, just to kind of show the 3 side by side. I don't go into the details about the differences, but you can look at approach number 1 as being sort of the most health protective. It is basically adopting the reference concentration that Health Canada has determined. Approach 2 is the reference concentration with a slight adjustment. So if you would look at the reference concentration, say as the floor, and the lowest observed effect level is the ceiling. This is kind of adjusting upwards slightly for achievability. And then of course the third approach, which is de novo development of a guideline level. So, and then I do see that we also have some questions in the Q&A.
I can answer the first one.
Yeah.
First of all, this is not a standard, this is a guideline. How do you account for confounding effects of PM 2.5 and co-generated byproducts? At least the first 2 approaches are using Health Canada's, studies that they use. For the short term, those were controlled exposure studies that they use to set what they call the point of departure, or where the lowest effect is seen. And epidemiology studies were used for the longer term. So in both cases, they did look, one is just a plain chamber, and the other they accounted for possible co-generated byproducts or confounding byproducts as well. So I guess that's best answer for this one.
And then as far as a question about, or Kai, I'm sorry, I don't want to take away your job.
That's okay. Catherine Pruitt asked, what do you know about ways that the WHO and Health Canada guidelines have been put to use to affect change in policies and practices?
Yeah, so that's a great question, and one that has come up in our previous workshop. And it's a combination of things, but those can be used to ideally to influence perhaps emission standards from products, stoves and others. Can also be used in building codes to improve ventilation or air exchange. It can be used just in terms of information out to the community, so that people have a sense as to what is healthy, what is unhealthy, and then they can monitor themselves to see if they're, reaching unhealthy levels in the home. And then there may be some other things I don't have, or Bonnie, anything else?
I can talk about WHO. I do not know what countries or other places that adopted their guidelines. Keep in mind, their guidelines are for indoor and outdoor exposures averaged over a year, which is kind of the reason we did not consider WHO for our analysis, but they put it at certain levels, and they're expecting governments in other countries to adopt those in their policy. So I'm not sure which governments have. It's been pretty recently. For Health Canada, with respect to our indoor air quality guidelines, we did ask them what policies and practice have been used, and they told us the example was for their carbon monoxide indoor air quality guideline. They actually used that level to help set what levels carbon monoxide alarms should be at in Canada. So that is a case where, you know, a policy and practice has been used with an indoor air quality guideline.
And we have posted the video of the first workshop, have we?
Yes,
Yeah.
Correct, so
Yeah.
people.
and the slides. It's all
And
posted.
slides from the first workshop, which was last spring in 2023. But as has been presented, we had those representatives from WHO and Health Canada presenting. So if folks wanted to go back and look at their presentations and how they discussed them, that might be too. And go ahead, Kai. I think there's a couple more questions.
Yes. What are prime benefits of guidelines? Is regulation not considered because of ethical reasons, such as going into homes is difficult to regulate pollutants?
Answer that one. I'll answer the second part first. Yeah, right now our authority is limited to our air cleaner regulations. So that's part of the reason why we're doing guidelines and not standards or regulation off of that. Yeah, and it would be difficult to regulate indoor pollutants. The prime benefits of guidelines, well, essentially the first part, it's what CARB thinks is, or through analysis, is considered a safe level indoors. And that can be used on a variety of fronts. I mean, even though it's not a standard, not a regulation, we've had researchers who've been looking at NO2 inside homes and not having a more recent indoor guideline they can use as a level. You know, they're using sometimes the outdoor guidelines, which isn't totally applicable. There are other, I guess, agencies which do certifications. They may want to look at what is considered a safe level. And also for the general public, right now, low-cost sensors are getting more popular. Somebody do measure NO2, and then when they measure it, they want to know, is this a safe level or is this level not safe? So that's some of the benefits of having a guideline out there.
Okay, we have a question. I may have missed this. How were the guidelines developed for approach 1? Also, will there be any guidelines developed past daily exposures, such as weekly, monthly, or yearly?
See, yeah, I can do, let's see, how
Why don't you go back? Yeah.
are the guidelines?
The
Okay,
actual guideline. Well, actually, you know what, let me go to the guideline. Yeah, one, sorry, there we go.
okay, well, in both cases, actually, for both approaches, Health Canada looked at all the existing studies. It could be controlled exposure studies, it could be epidemiological studies, and came with, you know, what toxicologists call the lowest observed adverse effect level. So basically, under this level, it should be safe, but then, you know, to account for sensitive individual groups, there are some uncertainty factors which divides by that number to get their final number. So that's, let me see. Let's see, the key, yeah, but will there be any guidelines developed past daily? I don't think so. I think
Yeah.
our guidelines are mostly for a 1 hour, 24-hour, what is considered safe. Mainly because people want to know first, a lot of the sources, the indoor sources, are very short term. And we want to know, like, if someone's cooking for an hour or 2 hours and the NO2 gets higher, or there's some other source, whether or not that's safe or not. Yeah, over a year, that would be a little bit more difficult to do.
Okay, we have a question from Tom Phillips. How would the guideline be marketed, implemented, and evaluated? The current guideline had limited support for awareness building and implementation. Nonetheless, by setting a risk reduction target, it helped effectively ban unvented gas space heater sales in California and may have helped adopt CO alarm regulations. So I guess the real question is, how would it be marketed, implemented, and evaluated?
Yeah, that's a great question, and it's interesting coming from Tom, because Tom was instrumental in developing the guidelines back in 1994 that were originally written. He developed that document and set those, I think, early guidelines. And yeah, Tom, that goes to our last question: how can we improve our outreach efforts to maximize the benefits? So thank you for that. And you know, that's kind of why we're here. I mean, I envision it as being I think it's going to be marketed through the community groups. Hopefully, we're going to do outreach into the community. Obviously, we would have and we would announce it here at CARB and go through social media. There would be all of those mechanisms. But I think it's going to be working closely with community groups to get that information out there, to let them know the importance of it, that they can use this as benchmarks to what is healthy and what is unhealthy. And I think there are certainly other mechanisms as well. So that's part of why we're here. We're hoping to hear from perhaps some of the community groups that might be online, what would work to get this information to communities and how can they use it.
And I would just add that we will be working closely with our agency partners too,
Yes.
as we are now with the Energy Commission and other agency partners to share this information and strongly encourage our agency partners to incorporate this information and use it to inform the programs and policies that they're working on. We also would work closely with our public information office in designing an outreach strategy. I mean, CARB has outreach strategies for protecting, for helping people protect themselves from wildfire smoke and other kinds of outreach strategies that are online. So we would certainly be coordinating with them. But yes, we very much would appreciate your input on ways that we can coordinate better and outreach, and that input is welcome now. It will also be welcome throughout this year as we're working on this indoor guideline. It's certainly very relevant, you know, throughout this process of guideline development. So appreciate it.
We just got another question. Was formaldehyde levels and effects studied, or will it be? And what are the impacts on toddlers or pets low to the ground as it drops from the stove, I guess the NO2?
It's right there on the
So
Q and
the
A.
questions about formaldehyde levels, and of course, we're focused today more on NO2. I don't know, that might be something that we need to follow up and provide some additional references in follow-up on our website, or send out information to the group.
So,
Yeah.
You want to share some?
So ARB is currently funding a research to study air toxics from appliances, including gas stoves. So we are still looking for a research proposal to come in, and hopefully that information will update our understanding on emissions from fuel combustions from like gas stove or water heater and space heaters.
Yeah, maybe we can put the link to our research solicitations in the chat, so folks can take a look at that. Thank you, Zoe, for mentioning our current research solicitation. It's not focused specifically on any one appliance. It's focused on appliance emissions from homes that vent to outdoors.
Brett has his hand up.
Yeah, two comments. I'll try to keep them brief. The first, I'm just picking up, I think it was Pat earlier that mentioned, low cost sensors or just, any kind of sensors for measuring NO2. It is something I think is getting back to the communications. It's super important because there's like almost nobody is going to get into their hands a robust or high quality enough sensor to measure NO2 in their own home accurately enough to be able to say whether or not they're meeting the guideline levels, especially since the guideline levels are pretty low. So again, this is like both practically to save yourselves, ARB, right? From lots of people calling and emailing and saying, I'm being poisoned in my apartment and my landlord just won't help and he won't recognize it. Like he's not following your guidelines. So be proactive about that and saying like, basically like there are not like you can just say definitively, there are no low cost sensors that will allow you to measure these levels, right? That, these guidelines are designed to help us, set targets. And then here's the thing you should focus on, follow these strategies, right? So, and again, you did a good job of, I think, discussing them. I know you guys know them very well. About what the strategies are. And then the second comment, and I can say more about that if anybody wants, but the second comment is about what technologies and practices will best help. This, but I'll just affirm it, is obviously using ventilation, right? If they have a range hood. And even though there was some discussion earlier about like, this is not, you're not trying to reduce PM 2.5 from gas stoves, right? Or from cooking, but there's, when you ventilate a gas cooking appliance, you are also ventilating all the contaminants that get produced from cooking and also the ultrafine particles that are produced and the moisture that's produced from the gas burner. So like there's all these commensurate benefits that go along with it. I think highlighting that is really valuable, right? Saying, hey, in general, it's good to ventilate when you're cooking. If you have gas, it's even more important, right? But if you don't have gas, you should still do it. And then the other strategy is mitigation, which is somebody mentioned the portable induction burners, right? Replacing a gas stove with electric is very expensive because you need a 240 volt circuit, which is could be thousands of dollars, right? It could be maybe as little as $1,500, but it's usually like more than that. But even if you have a gas stove, if you can get a portable induction, even a single portable induction burner, and reduce like half of the time you're using a cooktop burner with that single induction burner, that can safely be used in most homes, right? Because it's a kitchen appliance essentially. Then that's a very low barrier exposure and very effective exposure reduction. Again, you might cut half of your NOx emissions from gas stoves, right? You're boiling pasta, right? Those things work great for things like boiling a pot of water, right? They work less well for things that, involve very precise control with certain pans and stuff. Some of them are fine, but some things are harder. But again, really emphasizing that like, it's not an all or nothing thing. If you use one of those, that's great. And then the other thing is, when you jumping ahead, right? If people are using them, if they can use them under the range hood and ventilate, if they have a ventilated range, venting range hood, then they don't have to compromise between like, shifting from gas to electric, but then not being able to like get the benefits of ventilation, right? So like you don't want someone, instead of using their gas burner with their venting range hood, their back gas burner with their venting range hood and getting maybe an 80% reduction, instead that they like, put this thing on their countertop, don't use the range hood, and then they get the 100% reduction in the NOx, but now all of the PM 2.5 and other, VOCs, irritants, carcinogens from whatever they're cooking wind up in their house, right? So like, comprehensive risk reduction, I think, is really important. Again, it gets back to the messaging and the communications.
Thank you so much, Brett. Yeah, I'm really glad you brought up the NO2 monitors. In my experience, even what we consider at the lower end, the electrochemical sensors that are available, they are also susceptible to interfering substances like ozone. Sometimes even just, changes in humidity can affect them. But I think one thing
Well, and Jeff, sorry to interrupt, I just briefly, it's not just those things. Yes, it is those
Right.
things, but also when you start getting to low levels, then the background, like they're pretty good at looking at the increase from whatever baseline they have, right? But absolute levels, they are really not designed for that. They're not good at that. There's like, and that's something like maybe a little hard to, rather than trying to communicate like, well, you can look at peaks, whatever, like, I think it has to be simple. You have to put your public health hat on, right? And be like, look, you cannot use these sensors to see if you are meeting the guideline levels, period.
And that's kind of where I was going, is to say that, yeah, you get down to that 5 ppb, they're not going to cut it, not even close. Yeah, I understand that. But what I was also going to say is there is a lot of emphasis or a lot of work on developing new technology and new sensors, and that hopefully maybe down the road there will be, just like we didn't have great sensors for PM that were cost effective and that we could use in our homes, and now we kind of do. So but also, yeah, thanks so much for mentioning the portable induction stoves that you can just, I think, throw on a countertop. And I just went ahead and threw up a slide that I had created about programs for incentivizing electrification. Yeah, and like in the Bay Area, Ava Community Energy, I think they have a loaner program. I believe PG&E does. I believe SMUD does. And you can actually try these things out and see if you like them. And there's no cost to the individuals who, maybe I don't want to pay several $100s for one of these things. I can try one out, see how it works, or a long-term loan. So there are resources. I don't know the particulars of all these, but I will include this slide in the slide deck when we save it. This is in our extra slides, but I'm going to include this so that everybody will have it. So yeah, thank you again, Brett.
It looks like we have some other questions. I know Tom has a question about multi-pollutant health effects.
I can handle that one. Yeah, for the other NO2 guidelines, I don't believe they consider multi-pollutant. Just like us, they're focusing on just the chemical itself, just because we need to have a guideline for the individual chemicals. Now, the multi-pollutant effects, that becomes more of a different analysis. You're looking at different sources, combustion sources, which is a little bit different than guideline setting. Currently, we do have a contract with Dr. Yifang Zhu from UCLA to update our 2005 indoor air quality report, where she will be looking at sources in there. So I think that's where that type of analysis would be. And yeah, thanks for the study on gas stoves with mold and asthma. Yeah, maybe we'll take a quick look at that. I did want to go back to a question from Alice. You mentioned whether or not there were any studies that looked at toddlers or pets, because yeah, NO2 is quite dense. So I have not seen any studies where anyone's looked at gradient. Let's say in a home, is there more NO2 under 4 feet? I've not seen too much of that, but that's actually something interesting to look at. So
yeah, I will say, this is digging up some old chemistry, but typically you get even those heavier gases. It's very unfavorable for gases to remain partitioned. They tend to become well mixed very quickly. It's just energetically unfavorable for them to remain unmixed. So if there's any movement around in the home and others, it will probably mix pretty completely. And if anybody with a solid chemistry background wants to interject on that, that's fine too.
And I just want to thank everyone again for the comments about multi-pollutant effects, but it's a very good point, and we're very aware that there are other pollutant emissions from indoor cooking and from appliances. And we do need to keep that in mind as we're thinking through the guidelines and as we're thinking through the messaging, the public messaging that we're doing. Because we certainly don't want to give the impression there's only one pollutant of concern. But we do need to go at a stepwise process in terms of adopting guidelines. But appreciate the concerns and agree that it's important in terms of our messaging to recognize and underscore the importance of measures people can take to reduce all their pollutant exposures.
And I just saw that, I kind of made the same comment I made about well mixed, and that would apply to formaldehyde as well.
Hi, we have a question from Tamara Abrams. I've read in the gas stove studies that a gas stove, even when off, emits toxic chemicals. Do you know of a visual reference showing the average leakage level of gas stoves when turned off compared to when on? Something that non-scientists can understand for those of us who haven't gotten rid of our gas stoves yet.
You know, I think that I'm familiar with the paper that covers that. I think in terms of more something that's to the general public, I believe that's discussed in either the RMI or WE Act articles about gas stove use, and I apologize, I don't remember exactly, but there is a resource, and if you want to send me a note, I'm happy to send you that resource when I can have a chance to look it up. But I am familiar with that, and yes, there tends to be, when you have a pilot light or a hookup to gas stove, benzene and other compounds are just passively leaked into the space, and so that is another consideration for being careful with the use of gas in the home. And does Brett have his hand up?
Yeah, it's on the, I guess, the formaldehyde heavier than mixed air.
Yeah.
Yeah. Yeah, please.
It was about that last point, actually, just very briefly, like, the issue is, it's not just gas stoves, it's actually like, water heaters also can have leakage of natural gas, and that natural gas contains some trace amounts of benzene. I think that was the carcinogen that was discussed. So depending on what the benzene content is in the natural gas, as that leaks into your house, it is a source of benzene. But actually the paper showed that, like, what they did is they looked at both benzene leak, natural gas leakage rates, and also benzene concentration in the natural gas. And if you see, it was basically like extraordinarily unusual to have any significant amount of benzene like leaking into your house. There was another paper looking at kind of direct benzene emissions when you're burning natural gas and you're using natural gas flames, and there's also benzene there. And that came up as a slightly larger number. And under some circumstances, more common circumstances, but still uncommon, you could have, benzene levels that start getting significant relative to what's coming in from outdoors. Okay, but still, it was like the hazard associated with the benzene was still way lower than with like the NO2 or the ultrafine particles, like the direct predominant emissions associated with the gas burners. The unvented gas burners are really the key.
And again, that is a topic of our current research solicitation, and so we put it in the chat, or in the queue, in the chat.
In the chat.
Yeah, to look at the toxic emissions. I think we have some comments.
Yeah, can public see the Q&A?
Yeah.
Oh, they can't.
It's up there on the
Oh,
screen. Oh, no, they cannot. You can hop that over to there if you want.
okay,
I think the comments in the Q&A have
that's-
all been answered.
oh, okay. Okay, yeah, I can read that out, but yeah, if there are comments that you would like the whole group to see, yeah, please put it in the chat area, but I can just read this. Yeah, Tom Phillips had a comment on implementation. Number one, focus groups and demonstration projects would help fine-tune mitigation efforts and spread the word. Number two, guidelines should be used to design and evaluate state programs for environmental justice, decarbonization, etc., for state mandates for addressing health and other non-energy benefits. Current environmental review of such IEQ impacts is very limited. Okay, thanks, Tom.
We still have a couple of open questions, is that right?
Um, Jeff, could you please post in the chat again a link where people will be able to submit comments?
Yeah, I'll go ahead and do
Thank
that.
On the last page, last slide.
It is on the last page. Or here, maybe it might just so that everybody will have it. The bottom link there, that's the comments link. I'll go ahead and put it in the chat as well, just so you can grab it easier. That is the comments link. So, but basically that's under our NO2 guidelines webpage. So you can Google it, however you want to get to it, go to NO2 guidelines CARB, it'll bring you to that page. You'll see a link to the workshop number 2. From workshop number 2, you'll see a link to comments at the bottom.
So we've had some responses to many of the questions, which have been very helpful. I'm not sure if we've had a lot of comment on equity implications and barriers for low and middle income communities. If anybody would like to comment on that.
We have any representatives from, say, community-based organizations? Yeah.
If we have any
Or others,
participants,
yeah.
people that are, whatever your interest or background, but also if we have folks from community groups, that would be great too. Beth Keller.
Hi, Beth.
Let's see. Hi, everybody. My name is Beth Kelly. I represent Bay Run and 3C Run. They run energy efficiency programs that are authorized by the Public Utilities Commission. So regional energy networks are basically local governments that get together, deliver energy efficiency programs. And sorry, I'm giving a little bit of background because people don't tend to pay attention to us. And we're restricted in what we're able to do, but almost all of our programs are equity programs. And so we're seeing, obviously the barriers of, making these NOx changes over time, but, we're able to pair that with energy efficiency as well. So it overall increases the health, safety, comfort of residents. I think that there are a couple of almost administrative barriers. There are some challenges, even at the CPUC for like the being able to do these programs cost effectively. And, I think there are, there are things on the back end that would make things a little bit easier. And then I would say that another, concern of ours is, there's movement up in the legislature that's kind of saying, hey, why don't we, essentially get rid of energy efficiency and especially equity energy efficiency. And those trends are very concerning because without that, it's hard to imagine how we can get our most vulnerable customers through this electrification transition, not just on stoves, but, hot water heaters, HVAC. But obviously, like these are also the same communities that are being the most impacted by these health and safety concerns. I don't know if that entirely solved or answered one of your questions, but that's the perspective and feedback that I guess I would very much support this effort to improve health and safety for our communities.
Thank you. That is very helpful to hear that perspective. So thank you, Beth. Appreciate it. Any other comments on that same topic?
Not on that topic, but I wanted to go back to the thing before with the air quality sensors. Is it okay now or should I wait for that?
Yeah, that's fine, Brett. We have a fair bit of time, so I think we're okay.
Just want to, I don't know if Maninder is on the call from CC. Maninder is a CC program manager and his program, which funded a lot of the research that Jeff mentioned earlier. They did a preliminary like information request and had a public session about a possible solicitation or they call it a grant funding opportunity for developing indoor air quality sensors. So that problem that we were discussing earlier, like it's not going to be solved tomorrow, but at least, credit to that program, which, as we've said, is so awesome, right? It's because of that program that we have so much of the knowledge that we have already. So they're proactively looking at the sensor issue and trying to, help on that issue too.
Hi, everyone, this is Maninder from CDC. Thanks, Brett. Thanks for bringing that. Yes, we early this year we did have a scoping workshop on the research to identify gaps and challenges in the low-cost sensor technology and develop a new low-cost air quality sensor and validate in the indoor environment. So it's under development and we are hoping to release it soon. And I'll put the link to the scoping workshop there as well.
Thanks, Minder. Yeah, just you throw them in the chat, that would be great.
And so we has a
Yes, so.
Yeah, so want to add on that, we have an ongoing white paper project about low-cost sensor, and the focus is to investigate the available low-cost sensor in the market and summarize their technical specifications and how people used it in studies and at homes. And so we will have the draft report very soon, and that will include the table of available local sensor in the market for different air pollutants, and it's specifically used for indoor settings. So please stay tuned, and I can add you to our distribution list if you're interested in that report.
Sorry. Kai, can we go back to the Q&A? I see Tom has another.
Yes, Tom remarks, how well are automatic range hoods with IEQ sensors working and being used properly? CARB recommended this mitigation report in the AB 1173 report to the legislature. DOE funded development of this technology, and several models of smart hoods are now on the market.
Yeah, thanks, Tom. And this isn't really my area. I'm not that familiar with the IEQ sensors, but Brett, it seems like something you might be familiar with, or Zoe.
Yeah, these are new stoves, which if people are cooking, I do not know what triggers it. Is it a monitor or?
Well,
if
it's
you're
the
burning off it?
hoods, right?
Yeah, is there
Yeah.
a sensor in it?
I think it's a PM. I
Okay,
think
yeah.
Yeah.
Yeah, if it senses something, the hood will turn on automatically because not everyone turns on their hood. I just don't know how effective they are. I mean, anything that turns something on that's not normally not on would be good.
Right.
But yeah, I do not know
Yeah.
too many studies.
I mean, yeah, typically range hoods are only used anywhere from about, as low as 15%, but about 25% to maybe 50% of the time. I think it was actually one of the studies Brett did that concluded that. And yeah, so they're not used very often. And of course, air cleaners are the same thing. You have that same similar technology in air cleaners that they'll kick on, say when PM reaches a certain level. But yeah, Brett, is there something similar?
He actually put a link.
Oh, you did?
I put
Okay.
a link in, credit to PG&E for funding it and to TRC. This was Barry and Gov's group at TRC, Shruti Cole and David Douglas James. And then the project people at I just like you can see it was Mark Alatorre and others at PG&E. I want to credit them because like it was a kudos to them for proposing it. They did a really nice study. We gave some input to it. And it the summary finding was like there's promise there. They're coming along. This was a couple years ago, maybe at this point. I think it was 2022. So there's been development since then. But and it's the issues, Jeff or Pat, that you brought up, right? That they're sensor based, right? But the advantage is it's a little bit easier. I mean the air cleaner is actually like the problem is that they just have really, really cheap PM sensors. If they were to use the $15 PM sensor instead of the, 50 cent or $1 PM sensor, they'd be a lot better, but they don't. But these range hoods, you know, they sense some combination of VOCs or heat or infrared or something, and they kick on, and they can be very effective. One of the issues is noise, right? So like, you know, getting the controls right so that they're modulating appropriately, not moving up and down too much. There's some non-negligible engineering challenges, but again, I refer people to the report. It was a pretty nice study. And I suspect that within a couple of years, there's going to be some really nice products that will be available. They won't be accessible to everybody, so they're going to be, you know, hundreds of dollars. But you know, they'll be accessible to many people.
Thank you. See, we don't have any open questions in the Q&A. And it looks like chat is also similarly quieted down.
If
Yeah.
it really quiet, I have one more if I can. Sorry, but you know, you guys had the time though. On the
Pick your brain, so.
yeah, no, that's fine. I really appreciate the opportunity. So the last question of improving the outreach efforts, right? So this is the attached at the hip version of the communications, right? So like the communications is not just like thinking clearly about technically what is achievable and from this public health perspective of risk reduction, right? And not making it an all or nothing thing. But as you guys correctly pointed out, right, the communities and the people that are most affected by this are going to be people who are living in smaller dwellings, have to cook a lot because they don't have a lot of money, right? May not have good equipment, even if they have a venting range hood, it might be very old. They may have an older gas stove. Okay. And they may also just be like farther away from the like standard A or B, you know, CDPH, you know, information flows, right? And I saw Tim Tyner was on at Central California Asthma Collaborative, right? They do tremendously great work. Fresno, Bakersfield area and surrounding communities, they're going to start working in Stockton. They do this really nice asthma program. Full disclosure, they're partners with us on that Civica study. But it gives me a chance to see up close how they work. Central California Environmental Justice Network, we work with them on a project, the Fresca project. They're also terrific. There's lots and lots of groups. I call them out because I just happen to have like a personal experience working with them, but many really fabulous community groups. And I think like doing outreach to the community groups to make sure that they get into their hands good technical information to help with risk reduction, and then developing communications in collaboration with them and maybe even supporting them to develop communications, right? And what ARB can do is like provide the good technical input so that what they are communicating to their communities is technically accurate and appropriate, but they're the experts in knowing where their communities are, right? Rule number one of communications is you meet people where they are. They're there with the people, they know it. So they're the like perfect go-betweens between like, because they have very good, savvy, intelligent, technical, you know, oriented people who can understand all the technical information, and they also know the communities. So like work with them, help them understand the technical pieces, and then empower them and you know, and again, ideally give them grants, right, to communicate this stuff, because they're going to do it a lot better than you are or I am. Anyway. And if Tim's still on, I mean, he's a busy guy. He's running a huge, you know, agency, nonprofit there. But if Tim's on, maybe he can comment, or somebody else, if there's anyone else from the community groups that they really, I think that's the key to getting the message out to the communities that can most benefit and most need it.
And yeah, and it does look like, I mean, I see Tim listed. I've asked him to unmute if he wants to say anything.
Yeah, so I hope, Tim, I'm not getting you at a bad time there. Again, he's busy.
That's very helpful. Thank you.
Yeah. Thanks, Brett. And actually, I do have a comment on that, and maybe Tim or others could weigh in. We talked about talking to community groups and getting the word out. A lot of vulnerable communities, or in fact, residents they don't own their homes. They stay in rentals. So they're basically, I guess the landlords or property management companies are involved in, their ventilation, appliances they use and so forth. What, for anyone online, are there any strategies possibly you think that would help in that case? Because, if I'm renting, I don't get to control some of the strategies that we talked about there.
Hi, this is Beth Kelly. So actually, this is something that Bay Run and 3C Run are directly addressing at the California Public Utilities Commission. So a couple of months ago, we filed a motion in one of the proceedings in R 13-11-005, specifically related to the multifamily sector, because it faces these very specific challenges. And again, this kind of gets towards how do we, increase the administrative flexibility to make sure that program delivery can happen. And so it's sort of the nuts and bolts behind the scenes that we're trying to work on, but it's an incredibly tough nut to crack. And I don't want to get too into it because this is a CARB meeting, not a CPUC meeting, but we presented 3 solutions, and I'm happy to follow up with any of you after the fact.
Hey, thanks, Ben.
We do have another question. Like carbon monoxide sensors in the home, are there compact sensors for NO2 indoors that can be installed and can be tuned to a guideline limit?
Yeah, and so Brett kind of spoke at length about some of the downsides of the sensors, that there really aren't low-cost NO2 sensors. That is something that is being actively pursued with funding from CEC and others to develop that type of technology or identify that technology. But at those very, very low levels, there's nothing that's what I would characterize as a low-cost sensor that is going to be able to accurately tell you if you're, say, at 5 ppb or 10 ppb. There are more research-grade instruments, but that's really not what we're talking about. So. But again, hopefully that technology is coming. And Beth?
Yeah. Sorry about talking so much. I guess I should also say that before the Public Utilities Commission, I also represent Environmental Defense Fund on all of their natural gas and hydrogen work. And there's a lot of push forward, especially as related to more sensitive sensors in the hydrogen space. We've been focusing on this in terms of the climate impact of hydrogen, but those the developments on the hydrogen side might end up having benefit on the natural gas side, because you're also looking at NOx as well as other elements worth considering.
Right, and I believe, if I'm not mistaken, there's also there's organizations looking at blended fuels, hydrogen and natural gas. Is that what you're part of what you're referring to?
Yeah, in part, but I'd be particularly concerned about the blended fuels. Like the most current research on that is really showing that there's even greater leakage impacts and impacts on indoor air quality with blended fuels, and in terms of like pipeline degradation and things like that. There's methane, which degrades, of course, hydrogen, which degrades more, but then if you combine the two fuels together, it actually degrades pipelines even more and creates more leakage, largely because in order to deliver the same amount of energy, you have to, put higher pressures in, because hydrogen is lower heat rate kind of fuel. Anyways, I'm happy to get into it, but I would urge some real caution in getting towards in looking at the blending as a solution.
That's been my understanding as well. Thanks.
Yeah.
And I know we had another helpful comment from Alice I think similar to Brett's, now it just disappeared, but focused on how we can collaborate with community-based organizations in getting the word out regarding indirect guidelines and providing accessible one-pagers in multiple languages and engaging CBOs and helping distributing and providing payment for help. Those are kind of strategies that we can certainly evaluate and potentially pursue. So I really appreciate those comments. And providing outreach on incentive programs and benefits. Those are all excellent comments. And so thank you so much. I think we've gotten a lot of excellent input on all of these questions, which has been very helpful. I'm not sure we've gotten a lot into the potential cost to communities, but that is, that's one area we haven't heard much on. If anybody had any comments, please jump in.
Yeah, and I think indirectly Brett kind of alluded to some of the difficulties because, so many homes just don't have the 220, to run to stoves, and that's very expensive to, if you have to, for example, upgrade a panel, you have to put in additional capacity to get 220 to a place where you may not have even had it. That's a big barrier. So that's absolutely something that needs to be considered, sort of in the calculus of how this is going to work out.
May I comment on costs also? Sorry. But maybe I'll stop apologizing. On the costs, it sounds like a broken record. I'm gonna go back to the communications, right? Like, I think that like what Jeff just said, yes, there are costs to kind of get all the way there to replacing gas with electric induction. And I keep saying electric induction because I want to also just a quick note, right? In terms of the communications, the coil burners, the electric coil, the least expensive electric option, does have the advantage of getting rid of the combustion pollutants, but those electric coil burners, and there's not great data on this. So I'm saying this with a giant caveat that I cannot like give you citations to like fully back this up, but I think that there are at least potentially, and I believe that there are risks associated with the lowest cost electric cooking technologies, both in terms of burns, right? Because when the coils stay hot when you take the pan off, so it's much easier for someone to touch a hot surface and get a burn. And then also for fires, because again, if you throw a towel down or something like that, again, I think I've seen a little bit of evidence that suggests that. That's a side note, but getting back to the core costs, I think that like, if the communication is about risk reduction, there are strategies, there are these lower cost strategies that almost everyone can do, right? Even if you don't have a venting range hood, just recognizing that when you're cooking a lot, it's pollution, you're producing pollutants, so you need to ventilate, right? And so that could be opening windows, it could be turning on a bath fan, right? If they have an air cleaner, right, that doesn't help with the NO2 but it does help with the PM from cooking. And then again, any amount that you can change, you can replace or displace use of the gas stove with a induction electric cooktop, a portable cooktop. That's helpful. Owing to the programs that were discussed, right? There are lots of programs, and I think increasing numbers of programs to make it easier to for people to get their hands on those things. And again, maybe working with the utilities to make it even easier to get those portable induction cooktops as a way of substantially mitigating, if not perfectly. So the point being that like, yes, there are some costs to doing the mitigations, but for most people and most communities, there are ways to make that barrier, reduce that barrier and bring that down to the point. And then again, there's some relatively, basically no cost things that people can do just by improving ventilation. So if the communications, that's why you really want to work with communities to like figure out what the situation is with their populations, and they can know what to communicate to people of how they can reduce their risk with whatever tools they have at their disposal.
Thank you for that input.
Okay, I see, sorry, Kyle, I don't mean to step on your toes. I just saw that Alice posted, can we save the chat and email? So, yeah, I think we will save the chat and the Q&A. And I think what I can do is if there are links, any valuable information like that, I can put that in with the sort of the presentations and that information. I think what I'll do is I can just maybe create a slide or something to put in with the presentation so that you can view that, or I can create it as a separate document, maybe just a links document that'll put in the workshop number 2 webpage. So one way or the other we'll have, I can make that available.
Yeah, and I did see I guess, not a question, but a request from Alice. Could CARB please save the chat and email?
No, just answer.
Oh, you did that?
Yeah,
I'm sorry.
I just.
I'm sorry.
It's okay.
I wasn't listening. I was thinking that. Okay, thanks.
Comments from Tom about risk reduction. Did you mention that, Richard?
I haven't said anything.
Yeah, and Tom, you may want to put some of these in the in the chat, because I don't think most people can see the Q&A.
Tom's asking for any new research about reducing risks in apartments without a range hood, or he says there is some new research. So if you could send that research, I don't know if we're aware of that, it'd be helpful. If you could give us the references for that research, that would be great.
Yeah, familiar with process, but yeah, that would be helpful. Okay, Kai, is there anything else?
There are comments. Tom, I think you already suggested putting his information in the chat for all. And Layla made a comment. Non-polluting heat can be produced from piezo electricity. Was this considered during as an energy source? I'm not sure.
That's somewhat outside of obviously what we would be thinking about in terms of our guidelines, although the end result hopefully being that, yeah, if you have a clean heat, whether it's induction or coil, then yeah, that's potentially another way to deliver heat. But I'm not certain that piezoelectric heating would be robust enough for that. I mean, typically it's my recollection, it's usually for smaller devices or lower temperature. I don't know if there's anyone who knows a lot about piezoelectric heating, but I don't think that that's commonly used. I'm not sure that it's, again, efficient enough or robust enough for this particular application.
Well, I think we've had some excellent discussion and responses to all of our questions, and we all really appreciate everybody's comments, the questions, and the thought you put into the questions that we posed today and the options that we presented today. It's incredibly helpful. I think we can probably turn it back to Jeff. If there aren't any more questions that have popped up, be a quick check-in with Kai.
No further questions.
Okay.
Okay.
Yeah, I think we have kind of reached the end. This was great. Again, thank you everyone for the information. You know, this really actually provided a lot for us to think about and that we can carry forward. And so you know, this ended up being as valuable, I think, as I hoped. And so I do want to thank everybody for attending today. Just kind of to wrap things up, you know, the information that we've gathered is going to be incorporated into our next steps. So that was the goal, to get this information, and then we can start thinking about how we're going to draft our indoor guideline document. And once that document's complete, then we plan to have a third workshop where we're going to present the draft document to the public. And again, we're going to open it up much like we have today for an opportunity for comment and questions about the draft. And, you know, in the meantime, we welcome any of you to email us at our IAQ guidelines at arb.ca.gov email address if you have questions or information that you would like to share. You know, we're going to post the slides and the recording of the workshop. And that's going to happen in the next few days. Again, I'll try to, I'll create a chat-based document with links and things like that. So you'll have that information. And if you did have a comment or just for whatever reason didn't share it, but you know, you think of something down the road, you're also another way you can submit comments is through the webpage at the comments link below. Again, you can go to our guidelines webpage, go to workshop number 2, and you'll see the comments link at the bottom. So
Actually, Alice had a question about that. Do we have a deadline for these? I don't think.
and there's no
Yeah,
deadline. No, I mean, we are going to be working on the document in the next, you know, over the remainder of the year. And, you know, I expect to have a draft. We hope to have a draft towards the end of the year. But no, there's no comment. We're not going to close the comments. It's basically right now just open from now till the end of January or excuse me, December. But even that's not a hard deadline. So we just ask you to submit them as soon as you can. But with that, yeah, again, we appreciate your attendance and we do look forward to seeing all of you at our next workshop. So unless there are any closing comments from anyone else, I think we can go ahead and get back 3 minutes on our day.
Oh, wait, there is one.
What?
Hold on.
Okay, what is that?
Tom Phillip just put one in.
Tom asks, what are the risk reduction benefits of different alternatives in terms of the number of persons potentially affected and the degree of benefit? The data may be limited to support a detailed analysis, but some range or scenario analyses would help frame the discussion.
Yeah, we'll take that forward, Tom, and you're right, there's not necessarily, I think data would be limited to say exactly. It will benefit all those who take the efforts to put those mitigations or exposure reduction plans into effect, whether that be ventilation or adoption of induction. But sussing out the difference between the two approaches, yeah, we don't exactly have that right now. This is early in the process, so something to think about. Okay. Well, again, everyone, thank you very much for attending, and we look forward to talking to you all again later in the year. Thank you very much.
Thanks, everybody.
Thanks.
Bye-bye.
Thank you.